Well then, I think we can get started a couple minutes early then. It's 9:58. We'll call the meeting to order and turn it over to Calista for a roll call.
Chad. Okay. Kenneth Craig,
Present.
Don Murray,
Present.
Beverly Wilkins,
Present.
Helen Claire Tingling,
Good morning, everyone.
Jay Kirkland, Andrea Matrosovs,
Present.
Shirley Keaveney, Kevin Eccles, Chad Richards,
Present.
Sue Carlton, and Nick Saunders.
We have four for our meeting today, and with that, we'll move on. You have just been chatting with this week's couple of amendments to the agenda that I'll have here. We'll remove section 9.2, strengthening public health, which is something we discussed at our last meeting. We'll add one item to the in-camera meeting as item 11.4, and that will be information supplied in confidence by another level of government. And with that, I would ask if there are any other amendments that board members would see to the agenda.
Yeah, through you, Chair. I was just looking at the document minute 6.0, and based on the conversation I had with Dr. Era, where I'm understanding that there was an executive committee meeting that is not listed on here, and it is, if the executive committee meets with quorum discussing board business, like we should have a record of topic, who's there, any actions or recommendations. So I didn't know whether, I appreciate you got the minutes out so quickly, which said, oh my gosh, if it was before that, they would have been here too. And I'm just noting their absence and wondering if they can be included in a subsequent meeting agenda.
Through you, Mr. Chair, we did have the conversation. It wasn't about an executive meeting, rather the item that was just added in the agenda, in camera.
I understand that, but if there was a meeting in preparation for that, and if there was a recommendation that should come to the board about where that came from, it would seem in my, procedurally, that's all I'm questioning. The other, if I may, is regarding the in-camera 11 numbers. There is a report we received regarding timelines for the appointment of an associate medical officer of health. And I Googled that, and the document that we have in our closed session is popped up on Google. It's a public document. The names of the directors, the names of and I did not see in the in-camera thing any request for direction from the board to staff or anything. So if it's for information purposes, then I would recommend that it not be enclosed, because they're already public documents. I'm like, if there is, if you can assure me that there's going to be some confidential information that's presented, that's a different matter. But I would not attend if that was, if it's just for information, then shouldn't be enclosed. So if you could confirm that, please, Mr. Chair.
I'll look to Dr. Ara for direction.
Yeah, thank you. I really appreciate the very appropriate scrutiny to any item that goes in camera or not, because we need to ensure the rules from the ombudsman's office is met. The document you referenced indeed is public. However, the discussion might lead most likely to information about the individual person, and the board has the right to ask these questions, explore it, but it shouldn't be in public. So we're absolutely within our right to put it in. The decision that might come out of it will become public. So the board can direct the staff after the in camera to announce certain decisions that they made about the subject.
Okay, thank you.
Good, so no additional amendments then to the agenda?
I do not have any additional items.
Okay, I would look for, I did propose a couple of amendments to the agenda again, just for clarity, removing section 9.2, strengthening public health, and then adding one item, 11.4, information supplied in conference by another level of government, that look for a mover and a seconder for a motion to amend the agenda as such. Moved by Bev, seconded by Pam. Any discussion on that motion? Seeing none, all in favor? That's carried. So much. And then section 4.0 would be that we approve the by Ken, seconded by Don. All in, any discussion on that motion? Seeing none, all in favor? Perfect. It's carried. Thanks so much. So our agenda is approved. Section 5.0, disclosure of pecuniary interest. I'm gonna ask now if any members have pecuniary
Beg your
interest.
pardon, Chair.
Yeah.
I have raised my hand.
Oh, my apologies, Andrew. I thought you were moving or seconding, so.
No. Thank you, Chair. I just wondered if, because I recognize from the screen that there are additional people present in the room, I wonder if there could be introductions for the benefit of everyone around the table, including virtually. Thank you.
Excellent, that sounds good. Dr. Barr, do you want to complete introductions here?
Certainly. There is Dr. Brittany Graham. She's finishing her residency, and she's the future Associate Medical Officer of Health, Physician Consultant, and conditional to finishing residency, which she's already completed almost all components. And if you mean online, it would be myself and Deneen. Those are the only people around the table that are new.
This is my first impression.
Oh, please introduce yourself and mention a couple of things about your portfolio.
Okay, through the chair. My name is Chimera Korongwo. I'm one of the senior public health managers here at Grey Boost Public Health. My portfolio is I manage the health promotion teams within the health unit, which includes oral health, health promotion, healthy babies, healthy children, healthy growth and development, and I have primary responsibility for the school health program. Thank you.
Yes, also for you, Chair. I'm Andrew Barn, I'm the Senior Public Health Manager. So I have supervisory responsibilities for the managers for infection control, ID, sexual health, and the BPD program, and then direct management for the environmental health programs.
And my apologies that both senior managers presented to the board, but virtually not in person. So that's probably why I assumed everybody knows them.
I did the same thing. It's all good. Thanks so much, Andrew. It's helpful.
Good morning, Andrew.
Perfect. So with that, now we'll move on to the disclosure of pecuniary interest. And ask if any board members have any pecuniary interest to disclose at this time. Seeing none, and remind you that if that arises during any time of the meeting, you may do so. On to section 6.0, adoption of our minutes. So there are two sets of minutes included in the package. One is our meeting on Friday, June 27th, as well as Wednesday, July 23rd, the executive committee, and those minutes are provided. Any discussion on the minutes as presented? No discussion there. Ask for a mover and a seconder that the minutes from Friday, June 27th, 2025, and Wednesday, July 23rd, 2025, be approved by the Board of Health as presented. A mover and a seconder for that. Moved by Ken. Seconded by Perfect. Any discussion on that motion? Seeing, Don?
I guess I should have mentioned it before. I still have concerns about the executive committee. And we've now had two people on this that were only present at this executive meeting. One is the chair that I've only ever seen for like 5 minutes in a meeting. So I'm really having concerns about an executive committee making decisions that don't come to board meetings. So it's just a very good, a concern I have. I don't know how to get around it, but I feel that it's only you now bringing any information back from being at that meeting and nobody else. So.
Discussed last time, there was an item in the executive committee that was not a major decision. There's procedure for the executive committee to complete. The second meeting that is in the minutes today is a direction from the board last time to complete a summary of the annual of a specific item and bring it back to the board. So the decision is not made there, rather a summary was provided. There is no other meetings for the executive that were not included.
No, and through you, Chair, that's part of my concern is it did come from this board. And the one person was not at the board meeting to hear any of the discussion of why it got put to the executive committee. So that's my concern. I know it's coming back and it wasn't a big decision, but it's still, that's a concern I have.
Through you, Chair. I'm trying to balance out the concerns of the board and the reality of the situation we're in, and honestly, it's a peculiar situation where the executive committee membership is in a peculiar spot. And I'm wondering if we could get a report from staff regarding our ability in a situation like this to appoint an additional member interim until the resolution of any necessary reports that we have to receive regarding member standings, like just so that there is like a definite quorum. I don't know what our policy says. I didn't review it prior to this meeting, but if staff could give us some information regarding our ability to include another member on that executive committee, that would be appreciated.
Yeah, through you, Mr. Chair, and definitely the board within its right to add members to any group. The executive committee is subordinate to the board, and if there is need to ensure quorum, the board can amend its policies. There is nothing against that in any way, shape, or form. I'm very comfortable even without consulting external partners or like the ombudsman's office to say that the board can amend the policy to include more individuals.
Through you, Chair. So if I may, I don't know the timing of when we might receive a report that would clarify some of this issue. Could we include on the next meeting agenda then, based on Dr. Ayer's advice, an election for an interim member of the executive committee until the resolution of the situation be brought to the boards? So I'm not saying it's a permanent spot, but it's just to provide guidance from the board, if that's an appropriate recommendation, Mr. Chair.
And Helen Fair, the comment, and then we'll. Go ahead,
Thank
Sarah.
you. Thank you, Mr. Chair. I'm profoundly concerned about the fact that in public session now we have brought out something that is to do with in-camera information that has been shared with the entire board in camera with regard to members who are currently not present. I am profoundly concerned about that happening right now. And I would ask, Mr. Chair, that all of us around the table be more diligent and that this not be permitted to continue, this kind of conversation that alludes to in-camera information. It isn't fair, and it's against procedure. With regard to the executive committee, I will reiterate that it is subordinate to the board at large and merely takes its direction from the board on specific information, which it then brings back to the board. The presence or absence of particular members is therefore not germane, providing one spokesperson, in this case we have the vice chair, is appropriately communicating what the resolution was at the executive chair level. It isn't required that every member of the executive chair then be present at the board level. Thank you, Mr. Chair.
Thanks, Helen Claire. I think that's fair. We have, I think to Ken's point, we can absolutely add it as a discussion at our next meeting to talk about that, and can definitely confirm here to the board that the minutes that you're seeing from the executive committee and the discussion that we'll have later on the agenda are based on board direction, and that's what we carried out at the executive committee level.
Just to clarify, I'm not talking anything about in camera. I'm just talking about the number of people that are on that and the minutes that are in this in a public document to be approved.
Yeah.
And my concerns are, we only have one person that's sitting around this board table at that executive meeting, so.
Definitely, I think we'd certainly put it as an agenda point on the future meeting. Helen Claire?
Thank you, Mr. Chair. Since my comments apparently are not being understood, the in-camera item is directly to do with the absence of people that has just been flagged in public session. Thank you, Mr. Chair.
Thanks, Helen Claire. Dr. Hart?
Thank you. I just want to reaffirm one point, that anything that went down in the executive committee was direction from the board, and it's procedural in nature. There's no decision about the board, rather the staff, the departments in the organization is providing information and summarizing the answers to come back to the board to be decided on here.
Appreciate that discussion. We do have a motion on the floor that we are approving the minutes from those meetings. So we've had good discussion generally about the minutes. So any additional discussion about the minutes themselves? Seeing none, then I would call a question on that motion. All in favor? Some hands there. Yeah. So I'll call it again because it wasn't super clear. All in favor? I guess carried. Perfect. Thanks so much. All right, perfect. On to item 7.0, educational notes, best practices for communication.
Thank you. It's just the item is part of our series of educational points that the public can listen to this and be reassured that we're following best practice. And in communication, it's one of these functions that go through the whole organization, the operations, the corporate, and the governance level. And we have refined this policy, internal external communication policy, and multiple times. And we are at the stage where the flow of communication in the organization is improved and enhanced continuously, and it's part of our continuous quality improvement. And just an example of the communication that might come, whether it is new indicator results from one of the operations or finance that needs to go to the operations, or a question from the public to the organization, or a question from the public to the board. All of them are going to go through the same channel, where if it comes from the operation, it goes from the staff to the manager to the senior manager. Communication is approved by senior management, and it goes out to the partners that we need. And so there is unity in the messaging, and there is vetting of every aspect of it, whether it is forgive me getting technical, but we look at any communication, we look at different variables to it, which is the content of the message, the vehicle that we're going to send the message with, whether it is a media release or internet messaging or you name it, the audience, which could be seniors in long-term care, or it could be teenagers in a school. That's totally different style of messaging and vehicle of messaging. And the final aspect of the messaging is the spokesperson. Who is the best person to speak to it? Is it of a caliber to be the Board of Health, the chair, or is it the frontline staff, or it's the management? So anything that comes in the organization goes through that. Whenever it comes to the board, it will usually come through the website to the board support admin. It will go to the chair, it goes to the MOH, and if it's related to operations, we go through it through the MOH and the organization. If it's related to governance, it will go through the board, and we send it back to communication for packaging with these four aspects of the message. Then we send it to whoever is going to be the spokesperson to it. So again, the results of 2 years of improvement of this policy, I just want to share with the board and the public that we are following the best practice or the better practice. We should change the word best. Recently, they're using the better practice because there is always improvement. Open to questions afterwards.
Any questions from the board about the policy or the presentation from Dr. Ara here this morning? Yeah, thanks so much, Dr. Ara. Thanks to the team. With that, moving on to item 8.0, correspondence and media releases. Item 8.1, we do have one piece of correspondence, and Dr. Ara, I'll turn it over to you.
Thank you, Mr. Chair. And we have only one item, like you correctly mentioned. It's a letter from the chair of the health unit. It's a combination of a recent merger of two other health units, Peterborough Health Unit, and I will say the acronym probably is easier, HKNP Health Unit, which is one of the newest health units. And it's directed to different levels in the provincial government, including the premier. We had received similar communication correspondence about the subject prevention of intimate partner and gender-based violence. And there is endorsements of previous communication as well that we also received. And that's why my recommendation is to receive. We have seen the subject multiple times, and usually we endorse if it's a new subject or we can make difference in the advocacy.
Okay. With that, then we'll look for a mover from a seconder that the correspondence be received by the Board of Health for information. Moved by Heather, seconded by Andrea. Any discussion on that motion or the item? Seeing none, all in favor? It's carried. Perfect. On to item 8.2, media releases. And Denis is here. Denis, over to you.
Thank you, Mr. Chair, and through you, there are 5 media releases on today's agenda. The first 2 releases are educational and proactive in nature, with the first issued June 20th advising people about an Environment Canada heat alert and urging people to take steps to protect themselves and their loved ones from potential heat-related illnesses during days with extreme temperatures. The second release, issued July 7th, highlighted the potential risks associated with feeding, caring for, and handling wildlife. Public Health also issued a media release on July 11th after samples from Northwinds Beach in the town of the Blue Mountains revealed E. coli levels above provincial guidelines for safe swimming. The release advised people that the beach had been posted as unsafe for swimming. And then 4 days later, Public Health issued a second release to advise the public about the lifting of that posting after receiving updated samples showing the levels had returned to within Ontario Ministry of Health guidelines for safe swimming and bathing. And finally, on July 15th, Public Health issued a release to seek the public's help in finding the owners of a dog involved in a biting incident in the Blue Mountains. And that concludes my media release report for today's meeting.
Perfect. Thanks so much, Denis. And we would look with the mover and a seconder that the media releases be received by the Board of Health for John, seconded by Bev. Any discussion about the media releases or information? None, we'll call the question then, all in favor? So it gets carried, perfect. Thanks so much, everyone, thanks, Tony. Moving right along to item 9.0, medical officer update, I'll turn it right over to you back there.
Thank you, Mr. Chair. So the update has three items. The first one is a standing item related to the opioid situation. In the last meeting, I mentioned that our resolution in Alpha was tabled, and the plan is to revive it through communication to the board of Alpha. That was done, and we are waiting for the response. The ask was to consider the resolution immediately during the summer, if they're looking not to lift it from the table in the September symposium. The second item, Mr. Chair, is strategic plan update, and that will turn into Shanir.
Thank you, Dr. Aaron. Through you, Chair, to members of the board, it is my recommendation that the Board of Health receives this report and update on the 2022-2027 strategic plan for information purposes. The Board of Health is required by the OPHS to have a strategic plan that establishes the Board of Health's strategic priorities over the next 5 years. The Board of Health's current 5-year strategic plan was developed in 2022 and it runs till 2027. The strategic directions identified in the plan include 1, community focus, 2, determinants of health and equity, 3, quality and performance, and 4, capacity and infrastructure. Between September 2024 and February 2025, a working group was assembled to review and update the strategic plan. The updated strategic plan was communicated to staff and community partners and is available on our website. The working group was also able to identify 15 key performance indicators to enable us track progress towards meeting the objectives of the strategic plan. Appendix A, that is in the agenda package, shows the timeline of reporting on these indicators, while Appendix B is a dashboard on the status of the 15 key performance indicators. From Appendix B, we are able to observe that 2 of these indicators have already achieved their respective targets, 4 are currently in progress, and 9 are still being planned. We will continue to monitor and report on these key performance indicators. With that, I'm available to answer any questions members of the board may have.
Sure. Any questions from members of the board or discussion about the update on the strategic plan?
Thank you, Mr. Chair. Thank you for the report. That's a great tool to keep us abreast of progress. And I'm wondering if you could elaborate just a little bit on what exactly planned means. Has that been implemented? Is that like 5%? Is it, we're still thinking through it? Could you elaborate just a touch on that, please?
Thank you, through the Chair. When we say plan, is that it is part of our indicators, but at this moment, we haven't started implementing any other activities in order to accomplish that indicator. So it's still there, but we've not started any implementation of initiatives in accomplishing that indicator. That's why it's still planned.
So if I may confirm, is that within the 2025 year or within the framework of the entire strategic plan extended out to 2027, 28 in that range?
Through you, Chair. So it's extended up to the end of the strategic plan, which is in 2027.
Okay.
Through you, Mr. Chair, I just want to thank the staff, the management for the complete work and going over and beyond. Many people put the plan for each quarter, so the result shows achieving 90% in the quarter. We're putting it for the whole plan. So if there is something that's 40%, that might be misjudged by a quick glance that we're not achieving. Rather, it is the plan, and we're very committed to transparency with the public to say to show where we're at and where we're aiming to be in 2 or 3 years. So again, that's a higher standard holding ourselves to.
through you, Chair, once again, and I echo Dr. Good work, well done. There are 15 strategic directions identified here in this chart, and all valuable components of public health. Are there 2 or 3 that you have identified that will be first in the queue to be addressed and implemented? Like they're all board approved and staff supported, all those sorts of things. But is employee net promoter score high? Like, is that taking a priority within that list, or is it maybe this is a question for Dr. Era as he directs staff, but as the board continues to monitor progress, is there 1 or 2, 3 areas in here that we could expect to see some reports about successes for some of the others? Is there a priority list? I guess that's the question.
Okay, through you, Chair. Thank you very much. So the way it is structured is, so we have the 4 strategic directions, and each of those directions, if you look at the dashboard, will have those indicators to try and see how we would meet them. Now, with regards to the question, if we prioritize one indicator against the other, I wouldn't say yes, but we just expect that all the indicators are going to, at the end of the day, lead us to where we hope to get in 2027.
Sure.
The indicators for each of these strategic directions just showing in this strategic direction, these are the things we hope to do, and this is how we're going to demonstrate we've met everything in this strategic direction. So unlike you can observe, there are some of those indicators, like we've already achieved 2 of them. There are some of them that are in the works, so there are some of them that are planned. Now, to bring the example you provided, which was the example on employee net score, I'll just quickly refer to. So the employee net score, is going to be assessed every 2 years. So we are looking at towards the end of 2025 in Q4, there will be a survey that will go out that will assess the employee net promoter score. Then the objective is that when we get the score, we will identify 1 or 2 things we have to do, it just gives us room for improvement. Then we'll come again at the end in 2027, we would do another survey of the employee net promoter score. Then that way we can be able to report to the board on how the score has changed from the end of 2025 up to 2027. I'll leave to Dr. Era, but what I anticipate will happen is when the score is accomplished at the end of 2025, which is the Q4, there will be an expectation that a report will come to the board to just let the board know what the score was at the end of 2025.
And just to clarify, is that number here? It's supposed to be 2026?
Oh, sorry.
Yeah, no, I expected, but I just.
That's the title.
Yes, no, I've never done that before. So
Thank you for observing.
just kidding.
That's the title.
Dr. Ara?
Yeah, thank you, Chair, for the holistic answer. To build on it, the core question, is there a priority? Yes, there is priority. When we put this strategic plan in 22, the goal, the main objective was mental health and the opioid crisis, and that remains one of the highest priorities. There was an objective strategic direction of the backlog, to address the backlog from the emergency, the pandemic, and that was achieved. So that was a priority number 2 at the time. Now it's achieved and completed, so there was something else would be in the priority in number 2. And again, it's a static and dynamic. We have the strategic plan for the 5 years, and we have goals each year. Measles, for example, was one of the priorities this year, and hopefully it's not gonna continue in other years. So the answer to your question, yes, there are priorities, and they need to be responsive to the need in the community. The second part of your question, which is very important, is reporting to the board. And we do have scheduled reporting calendar for the whole year that we reviewed in January, approved. And we add to it based on the need in the field and organization. If there is another flare of the measles outbreak in the fall and winter, most likely you're going to see a report added to that calendar.
Good. Just maybe a comment from myself. I think it's an excellent report in my day job, we do a lot of dashboards and Gantt charts, so I can't get away from these things. So one of the things that we do when we report in on progress on goals and targets is just to identify as well if any of those goals or priorities are like at risk or not proceeding according to plan. Just wondering, just verbally, Shemara or Dr. R, are there any of these indicators that maybe aren't where we might like them to be that we maybe need to add some more attention to?
Thank you, Mr. Chair. So at this moment, we're proceeding as planned. I can't identify an indicator at this time that is at risk.
Great. Excellent. Thanks again for that update. Very good.
Thank you. And this report is on enteric illness and with your committee, I'll be on the Dr. Grant. Okay, thanks, Dr. Henry.
Thank you, Mr. Chair. Through you, it is my recommendation that the Board of Health receives for information this report, which contains details on enteric illness in gray groups. Enteric illnesses are infectious diseases that affect the gastrointestinal system. So most commonly, they cause nausea, vomiting, diarrhea, abdominal pain, and they can be caused by viruses, bacteria, or parasites. So the purpose of this report is to provide information about the work that the infectious disease team does to investigate reportable enteric diseases. So under the Health Protection and Promotion Act, there are 14 reportable enteric diseases, which means that when there is a case of these diseases in the community, we receive notification of that case, and that goes to our infectious disease team. And a public health inspector follows up with that individual to provide education about how to prevent further spread of the disease in the community, and also to identify potential risk factors. So they undergo an investigation that can be quite comprehensive, covering potential sources of infection in the previous days or weeks before they became ill. And that information helps to inform the public health inspector to ensure food and water safety in the community. And that information is also shared with provincial and national surveillance systems. And so the information that they can collect sometimes at a local level isn't enough to identify a source of illness, but when it's fed into a provincial or national database at that level, the information can be helpful in identifying potentially contaminated food sources. So this report is really meant to showcase the work that the health unit is doing in this area. In 2024, there were 195 cases of enteric illness that the public health unit followed up on. That's about a third of all of the reportable diseases that we followed up on. And the second figure in the report shows that the rate of enteric illnesses in Grey Bruce are higher than the provincial average when you take into account the size of the population. And so some of the reasons for this locally is that agriculture is an important risk factor for enteric illnesses because handling animals and items in their environment can increase the risk of acquiring bacteria that cause gastrointestinal illness, as well as animal environments can lead to contamination of food and water sources. And so private drinking wells can also be a source of enteric illness. And so that's all something that our public health inspectors are aware of. They provide education in the community around food safety and safe practices for preventing enteric illness. And through the work that they do to follow up on these cases, they're able to support ensuring food and water safety in the community. I'm happy to take any questions about the report.
Through you, Chair. Thank you for that report. I heard you comment about the Bruce County, Grey Bruce, higher rates of, enteric illnesses. And you kind of put that on, our rural designation. Do you have comparable numbers to other rural jurisdictions? Because, you know, broadly speaking, we might be higher, but where do we sit compared to here in Perth? Compared to Glengarry, compared to other, are those numbers available?
That's a great question. Those numbers are available. I don't have them at hand with us today, but that is something we could report back on unless another member here has that information.
Just a number, like it doesn't need to be as in-depth as this, just, you know, here's where we are.
Yeah.
So that would be interesting for myself anyways.
Yeah.
But that's a board decision, whether that comes back. That's not a me decision. That's,
Thank you for you, Mr. Chair. I put on the screen comparison with the Ontario rate. And, for example, it becomes very difficult to compare certain health units because we don't want to comment on their, the rates. There are many factors that come into that rate, and the public might pass a wrong judgment that this health unit is doing better than this versus just the nature of the health unit is different, or the resources available are different, or so we go with the provincial rate usually, or comparison rate to health units that are similar to us. We'll be more than happy to bring something that is not identifiable to one health unit, rather a group of health units.
yeah, that's fine.
Any discussion on that one or other questions for?
Through you, Mr. Chair, are there particular communication strategies, and I think you touched on it a little bit, to be delivered to more rural communities? You've highlighted what the issues are, but I didn't know if there was like an active communication strategy to prevent illnesses like this. Can you just briefly comment? It might just be a yes or no. There is.
That is part of the work that we do here in public health, is to provide that public education around the potential sources of enteric illness and potential ways that the members of the public can protect themselves. And so that would be a multi-pronged approach that we would take within the health unit. So part of that is the follow-up that the public health inspectors are doing when there's a case, but there's also proactive outreach that we would do to ensure that the public has that awareness. Part of it is the food safety training certification that we provide, because that's also a source of enteric illness. And so ensuring that there is certification and knowledge among food handlers in the community around preventing enteric illness is an important piece of it. And then also the work that the environmental health team does to inspect food premises. A component of that is providing education in those settings around safe food handling practices and preventing enteric illnesses. And then there's work that can happen more broadly around education campaigns to the public that are more generalized around enteric illness prevention.
Okay, thank you.
Thank you. And building on that answer, and again, we can go probably 2 hours and we wouldn't complete all the types of communication. What you see in restaurants when you walk in a restaurant at the door, the posting of the safety and the level of safety, that's direct communication to people about the level of risk in that institution. We have communication with the provincial governments we have, and I realize this is not part of the question. And sometimes our investigations will trigger a federal recall of certain foods. Again, all of these, although they're going external, they'll come back through the different media to the residents in Grey Bruce to be aware about risk and of a product in their fridge directly and indirectly.
Any other questions or comments from the board? Seeing any, so with that, then thanks to the staff and Dr. Art for the updates, and with that, we look forward for a second year that the medical officer health updates be received by the Board of Health for information. Moved by Ken, seconded by Bev. All in any discussion on that? Not seeing none, all in favor? Thank you. It's carried. Perfect. Thank you so much. And with that, on to item 10.0, corporate services report. We have our financial page over to you.
Yeah, Mr. Chair, so through you, this is the May 2025 financial update for Great Bruce Public Health. As of May 31st, we are reporting a surplus of 424,000, broken down between 250,000 in our mandatory programs and 171,000 surplus in our senior sample program. Looking at our revenues, year to date, our revenue continues to be under budget due to the lower recognition of one-time funding for COVID vaccine and RSV in Q1. The municipal contributions for Great Bruce counties will align with budget by year end. And the direct compliance line will catch up to the budgeted amount by June 30th when we invoice the ministry for our Q2 reimbursable vaccines. For our salaries and benefits, we're under budget by just over $100,000. The WSIB rebate we received in March continues to be a significant contributor to that surplus, as well as some wage gapping we've had for positions that we're currently recruiting for. Our occupancy year-to-date expenses align with our budget, and our operating expenses, all lines except for one, continue to be under budget. We didn't have any notable expenditures to disclose in May. The dentist and dentures fee, that line continues to have the largest variance, which we are working with the dental team on hiring a permanent dentist to address that surplus that we have in the program. And that includes the main financial update. Happy to answer any questions.
Perfect. So with that, this here, we look for a mover and a seconder that the financial report for May 2025 we received by the Board of Health for information. Mover for the motion. Moved by Ken, seconded by Don. Any discussion on the report or the motion on the floor? Seeing none, then we'll call the question. All in favor? Carried. Perfect. Thanks, Kim. Perfect. That's takes us to our in-camera report for today's meeting. I would ask for a mover and a seconder for the going camera, and the motion would read that the Board of Health go into closed session at 10:45 a.m. to discuss the adoption of in-camera minutes, 3 items related to personal matters about an identifiable individual, 1 item related to security of municipal property, and 1 item regarding further information supplied in confidence by members of the government. Further, that RF in Rutherford, Denny Randolph, and the rest of them shall remain present. So the mover for that motion. By Bev, seconded by Ellen Fair. Any discussion on the motion? None. All in favor? Carried. Perfect. So we will move into our income portion of the meeting. So confirming that the Board of Health went into in-camera session, and that we only discussed the items that were on the agenda to discuss, and that direction was provided to staff on item 11.2.2 regarding the appointment of the associate medical officer of health.
Will you capture direction to the board chair in that acknowledgement as well, too, please?
And that acknowledge that we will be speaking with the chair about matters related to item 11.4.
Thank you.
And for greater clarity, it will be the vice chair that speaks with the chair. With that, item 12.0, look for a mover and a seconder with the Board of Health meeting be adjourned at 12:22.
I so move, Mr. Chair.
Moved by Helen Claire, seconded by Bev. Any discussion?
No.
Discussion. All in favor? Board's now adjourned. Much.